Welcome all to another episode of HomeoMitra Vartaalap, and today's episode is with Dr. Pratik Jariwala. He's the
Hello.
director at Dr. Jariwala Laboratory. For those of you who are in Borivali and the surrounding area, at least second or third generation would be knowing about this place.
I
So,
hope so.
so welcome, sir, to
Thank
HomeoMitra
you.
Vartaalap, our
Thank you so much.
podcast.
Thank you so much, Dr. K.
Before we begin, sir, if you could just tell us in brief about your journey of the laboratory, because it's quite a old establishment, and
Okay.
I have only seen it grow.
Okay.
And there is, sir, one thing common between both of us. I believe so. Both of us started our career in Borivali.
Yes, yes, yes. Absolutely. Yeah. Okay. So, I'm Dr. Pratik Jariwala, and I am a pathologist by profession. I finished my MD in 2007, and since then I've been practicing here in Borivali at Dr. Jariwala Laboratory. I have also done a diploma in business administration from NMIMS Mumbai. I am the director of Dr. Jariwala Laboratory, and Dr. Jariwala Laboratory was established by my father, Dr. Harshad Jariwala, who himself is an MD, and it was done way back in 1981. And it has been almost 45 years now since we have been providing services to diagnostic services to people around Borivali and in the northern suburbs of Mumbai. We are an NABL accredited laboratory, and we are ISO 15189 certified also. And we have a central lab which is located here in Rokadeli, and we have collection centers across Dahisar, Borivali, and Kandivali.
Great, sir. So the one of the reasons for having today's podcast is like we had our discussion in the pre-podcast talk is to talk about different type of fevers and
Correct.
about investigations.
Right.
So if you could just tell us that why is it important to investigate fevers, number one, and if you can include some of the statistics, because I know that every time you always share those statistics in the doctor
Correct.
group which is there, which
Correct.
is something very unique and interesting about Dr. Jariwala Laboratory. So if you could just tell us about different types of investigation which are necessary for fever
Right.
and the statistics.
Okay, so Dr. Kaur, I would like to first start with that, lab investigations are not necessary for most of the fevers. Okay. There is a misconception that, if you get a fever, you rush and immediately you start getting testing and, panic around, and that should not happen. We should always look at how the fever is presenting, first and foremost. Okay, we need to be examined by a doctor first, and then based on that, we can advise certain tests. For example, in this current season, there is a lot of upper respiratory infection which is going on. Okay, and this is most likely to be the common flu. Now, this type of infection doesn't really need to be investigated, right? We can just go to our referring doctor or referring physician and get the treatment started. Yes, of course, if the fever doesn't subside or the symptoms do not go in the next 2 or 3 days, that is a time probably when you should get investigated and maybe look for your flu panel or something like that, which covers the upper respiratory tract infections. Uh, However, the scenario will be different in the monsoon months when there is a lot of other illnesses going on, like dengue, chikungunya, malaria, leptospira, all these things. So in those months, okay, if you're getting high fever, you're getting chills, okay, it is always advisable to start with the investigations immediately so that we are able to get a proper diagnosis and then start with the subsequent treatment. So it will depend on the clinical scenario, when the fever is happening, what is the severity of the symptoms you're getting, right? And at the most, then if your consultant feels or your physician feels, then you can go ahead with the lab investigations.
Correct. So the process has to be followed that you go to your doctor first. Don't simply straight away go to the laboratory
Correct.
and then do it. Otherwise, there will be too many unnecessary investigations
Absolutely.
and we not be able to even find the cause of fever.
Absolutely. So we need to find a direction in which we need to investigate. It is not that we can just go and do everything blindly. See, because there is no end to doing the laboratory investigations. There is a long battery of tests which a laboratory can do. However, it is always better to speak to somebody before doing them. If your doctor is not available, you can speak to the laboratory also and tell them that so and so are symptoms, and probably they can also suggest you the investigations.
Right.
And then go ahead with it rather than just going and doing a battery of tests unnecessarily.
So, sir, any basic investigation which you can just talk about or tell us? And of course,
Okay.
sir, sorry, before that, any statistics that you have, any interesting findings or statistics that you have?
Yes. So see, interestingly, when we are looking at the statistics, so we generally go through them during the monsoon months, which probably we have shared with you also. So currently at this point of time, when you see that there is a lot of flu again going on, it is usually influenza A or influenza B. Sometimes this can be severe and we need to investigate. So we are getting an occasional swine flu strain also right now. So that happens typically during the winter months. And this year, of course, there's a lot of talk about the human metapneumovirus also, which of course we will discuss later. So that happens typically during the winter months. And in spite of malaria, dengue, and this chikungunya, salmonella, the typhoid, all those being very much endemic in our population, we don't see too much of that during the winter months and during the summer months. In opposition to this, once you start having the later months of the year, June, July, when the monsoon starts, that is the time when you get all this vector-borne illnesses like dengue, chikungunya, malaria, salmonella, leptospira. So that is the time when you see that all these illnesses, they are coming up in a big way. And additionally, at that time also there's a lot of flu which goes on and a lot of swine flu. So this year we had a lot of swine flu in those months also. So you see a trend, a rising trend in all these illnesses during the monsoon months. While in winter, it is usually the flu and the other illnesses are not really seen. Maybe an occasional case, that's all.
Sir, have you seen any change in the trend in the past decade or so when it comes to the kind of fevers which come up or the kind of investigation that you pick up in the laboratory?
Right. So there has been a lot of change, I would say. So earlier, what used to happen, once we used to have the rains, these illnesses, monsoon-related illnesses, they used to start towards the end of June. Okay, and they would get over towards the end of September in the Navratri period, when the rains are lesser. But however, this last 5 years, okay, what we've seen is that the onset of the illnesses has shifted. Okay, so instead of June end, the illnesses typically start mid of July, towards the end of July, and they continue till Diwali.
Oh.
Okay, so there has been a shift of onset of these illnesses by almost a month. Now we don't know the reasons for that for sure, but there has been a shift over there. And in addition to that, there have been a lot of new investigations which have come up. Like of course, COVID has made PCR very much famous. So there are PCR panels which are available. There's a dengue ELISAs which are available. Chikungunya ELISAs are available. So depending on the day of presentation of the fever, okay, and the duration of the illness, a doctor would advise that, okay, you are in the first 5 days of fever, you have to do the following test. You are in the second week of fever, you have to do the antibody test. So typically in the first few days of fever, what we do is we do the dengue antigen test. For if there is a chikungunya which is suspected, we have to do a chikungunya PCR. If you are suspecting typhoid, the gold standard is a blood culture. Okay, if there is a urinary tract infection, then a urine routine and the urine culture test. Okay, for malaria, of course, we have the thick smear examination, which is the gold standard even today. And if that is not available, we can do a PCR. Okay, so these are done, on the day 1 or 2 of fever, and typically when the fever is very severe. If there are mild symptoms, upper respiratory symptoms, then you can just do a routine CBC and hold on and see how the disease behaves. Okay. And if the fever is persistent and has not been investigated in the first week, then we have the antibody tests which are available in the second week, like the IgM antibody tests which are there, the Vidal is there. Okay, so we can follow up with these tests in the second week because they would usually turn negative in the first week.
Right.
Sorry, they would usually turn negative after 1 week. Yeah.
So sir, now that is about the change in the trend that has come up. And you also talked about new investigations which have come up.
True.
Has the approach of people, like let's say 10 years ago, 20 years ago, how it used to be about lab investigation,
right,
or the outlook towards lab investigation changed in the last years or so?
Yes, absolutely, very much. Now people earlier used to be very hesitant to do lab investigations. Okay, there were not many investigations available then also. We would always do the routine investigations first. However, now with the progression of the illnesses and the new tests available, people are now more accepting towards blood tests, and there are several occasions where they come and talk to us, okay, and we advise them the test, and something comes out to be positive. After that, they would go and refer to the family physician, which would save them time. So everybody wants to get investigated faster, everybody wants to get treated faster. So now people have started, being open to lab investigations, and they are more proactive towards getting it done.
So just a query from the medical point of view.
Yes.
What I have noticed is earlier it used to be that you would wait for 3 to 5 days for the
Right.
symptoms to maybe become more prominent for some localization.
Right.
But what we are noticing now is that even then we are not able to identify the cause.
True.
And
True.
therefore, whether is it justified to order investigation on the 0 to 24 hours, the first day itself.
Right.
Especially the specialized investigation like malaria
Correct.
and dengue.
Correct.
Is there any logic or flow chart?
So there is no flow chart as such, but I would put it across like in a way that what is the severity of the symptoms that the patient is having. Like when you have the monsoon months, I don't think there is any point of waiting for 2 or 3 days because it is going to be one of these 4 or 5 illnesses.
Correct.
Okay, so what we do is typically as practitioners, we would be prescribing a CBC. When we are looking at the hemoglobin, we are looking at the white cell count, the platelet count, which is very important, right? And we are looking and trying to identify what kind of infection it is. It is just a plain viral, or if there is a drop in platelet count, maybe dengue, right? Something like that. Or if there's a drop in the WBC count, maybe your typhoid fever. Okay, so we are looking at the CBC report, and along with that, we are also ordering a CRP, okay, or an ESR to see if the CRP is elevated, how high the ESR is, and probably trying and judge if the cause is again bacterial or viral. Okay. In addition to this, now the trend is that the 4 main investigations, okay, which are available. So like malaria, okay, so MP has to be done along with the CBC, right? You have to do chikungunya if there is a joint pain, a chikungunya PCR.
Correct.
Okay, a dengue antigen, as I mentioned earlier. Urine routine to look for urinary tract infection if there is a burning urination or burning micturition, right? And in addition to that, we also look at the general parameters like you would like to have one enzyme from the liver like SGPT to see if there is any damage to the liver happening. Okay, you would like to know baseline status of your kidneys with the creatinine test. So these are the few first line investigations which you would like to do depending on what season this fever is happening in. Now, if the patient presents with only fever, okay, and all of these are not a positive, or you're not able to find anything in this, then probably the next line of action would be a chest X-ray to look for a lower respiratory tract infection or a pneumonia. Okay. Again, if there's going to be an upper respiratory tract infection, I don't think there's any need to investigate unless you have a very high fever.
True.
So, this is how it usually goes in the first week of fevers,
So now what I understand, and I hope we are able to convey this to people, that every investigation has a reason behind it. It's not that we just simply write a list of investigation and there is said why so many investigations for fever. But then there is a logic behind it.
Absolutely. And see, you need to investigate more now because there are quite a few of these illnesses which have an overlapping symptomatic pattern. All of them will prevent with fevers. Okay, you will have rigors or chills in dengue, but the same you can have in urinary tract infection also. You can have those in your chikungunya also, right? And body ache again is a constant. Most of the fevers they present with body ache. So, it becomes very difficult sometimes clinically also to differentiate between this. Okay, and that is the time you will need to add on to more tests in order to save time and reach an early diagnosis.
Right, sir. And on that body ache thing, I just realized many a time patient used to come to us and ask us that you did chikungunya in the beginning, it did not come positive. Now after 1 month, again you are asking for chikungunya. Now that test is coming positive. It's a very common question. Obviously, the patient will ask. So if you could just put some light on that.
Right. So see, what happens is that, as I explained earlier, okay, there is for an early diagnosis, the tests are different. Okay, like in the first 5 days, if you're looking at chikungunya, and you're giving a prescription of chikungunya IgM, that test is not going to come positive. It takes at least 7 to 10 days for the IgM antibodies to appear. So during this phase, you should be doing a PCR. Okay. So typically this is a standard thing and standard query which we also face. That I had 4 or 5 days of fever, I had done this chikungunya test. Okay, it came negative, and after again a month, it is still the symptoms are still there, and it is coming positive. So then we have to explain it to the patient that in the first 4 or 5 days the chikungunya IgM antibodies will not be positive, because ultimately it is the body's immune response which is getting developed against chikungunya, and that is what we are picking up with the IgM antibodies. So instead a PCR has to be done. The same thing is with dengue also. So in early stages of dengue, you have to do a dengue antigen test. Okay, if you do a dengue IgM or a dengue IgG, that is not going to be useful. So which test to be done at what point of time is also important in order to reach a diagnosis. And IgM antibodies are not to be done in the first week of illness.
Okay, this is interesting and quite useful. So tell us in the comments if you have found something which has satisfied your queries that you have had so many for such a long time about fevers and investigations.
True.
Okay. So we have almost covered all the part of investigations of fever. Now, if we can take up and bring up this ongoing and burning topic of the HMPV virus, and I have also seen that your laboratory is doing a test for HMPV virus.
True.
So if you could just put some light on that topic.
So see, first and foremost, this HMPV virus is not a new virus. This virus has been there for a few decades now. Second thing is, it is absolutely not a serious infection when you're talking about HMPV. It causes symptoms more or less parallel to flu. Okay, in more than 99% of the cases, it does not need to be investigated. Who needs to be investigated for HMPV is people who have low immunity. So typically HMPV affects children more often than adults, and adults with comorbidities like diabetes, hypertension, old age. Okay, so these are the age groups where HMPV test may be required if the symptoms are very severe and there is very high fever. HMPV will rarely cause a lower respiratory tract infection or a pneumonia. Okay, usually it is upper respiratory tract restricted to your like sore throat and running nose and with a low grade fever. So there is whatever we are seeing in the media with the HMPV virus being detected here in India and somewhere in China and Singapore and all these places. I feel that there is absolutely no need to panic, and there is a lot of hype created around it. It is, according to me, it is not a harmful virus. It is something which we face every year, and probably many of us have already been infected with HMPV in the previous past, but we don't even know about it. So it is quite a simple and a benign kind of a virus. There is absolutely nothing to panic.
The reason for doing this particular test?
So the reason would be, say, as I said, see, most of the cases are not going to be requiring a test per se, unless there is a patch in the lung or a pneumonia and the fever is very high grade. Okay, that is the time you need to do the test, not otherwise.
Right. So basically, if you have to decide the line of treatment, and especially in those particular age groups which you described, that is where the test turns out to be beneficial.
Absolutely, absolutely. It is not indicated for the general public having cold and cough. You know, it is only for specific age groups and specific population with a pneumonia and high grade fever. That's all. Right. Nothing beyond that.
Right. So now this busts the myth about investigations of HMPV. Probably even if it comes, it goes, like you said in the beginning, that most
it may have. We don't even know because we were not testing for it. And again, at this point of time, right now, there is no real indication to test it.
Sir, any statistics related to the number of positive tests which have come up so far?
There have hardly been any. There is actually no statistical data available because there are hardly any cases and hardly any investigations being done.
Okay, great. So that takes care of the curiosity related to HMPV.
Yes.
Sir, any take-home message for people?
Right. So I can break this down into two parts. Okay. One, when the patient is actually having an illness or a patient is symptomatic, wherein you need to speak to a practitioner, either your family physician or a consultant, or if you're looking at fever investigations, you can come down to the lab and speak to one of our doctors, and then investigate it further. So that becomes a diagnostic part of the fever investigations. However, there is a lot of emphasis which I have started putting in the last 5 to 7 years is on a preventive diagnostics kind of a thing. Now, the preventive diagnostics is more commonly covering your lifestyle illnesses, right? And also certain screening for cancers. We are looking at lipid profile. We are looking to screen for diabetes. So these things, okay, fever will come and go, right? But these things are all chronic things and they are there to stay with you for a very long time. So what I usually suggest when a patient asks me is that, you get your fever investigations done if you have fever, okay, get rid of it. Okay, however, once you're fine, you look at the preventive aspect of it also. You look at preventive investigations, you look at health packages that are being offered, because those packages will screen you for chronic illnesses, and that is something which is going to do you more harm in the long run. Okay, there are cases, quite a few of them, where we have identified, young individuals with a very high cholesterol, with hypertriglyceridemia, and they have been put on treatment. We have seen young individuals who have a very family strong history of diabetes, but they have never been investigated. So then we have diagnosed diabetes in them, right? And many middle-aged people, we when we are doing a health package, we usually screen for your PSA or CEA and all this kind of markers. So there are quite a few people where we have screened for tumor markers, and they have been found to be elevated. And when subsequently investigated, okay, they have found to be cancer, and thankfully cancer has been picked up in early stages, and they have been treated early. So that has given them a normal life and a long-term survival. So take-home message would be this, that first, if you are symptomatic, okay, see a practitioner and investigate. But if you're not symptomatic, okay, you go in for a preventive health checkup at least once a year, just to see everything is fine with you or not.
Sir, where can the patients find literature regarding this? Like which kind of test should be done in which age?
Right.
Like you said,
Right.
tumor markers. Now,
Right.
for example, as a doctor, I would not ask someone who's 20 years old to do a tumor
Absolutely,
marker. So,
absolutely.
if there is any literature, I'm sure there must be some way.
Right. So there is no literature as such available on what should be done, but typically we keep a cutoff as 40 years of age. Okay, wherein if the patient is more than 40 years, we generally advise them to screen for tumor markers also, especially with PSA in males and CA125 in females, along with a pap smear. So these are the basic tumor markers that we suggest. And if a patient is of a greater age, they can always come and speak to the person who is there available at the diagnostic center, and they will be able to guide you.
Right, sir. Now, again, this was very useful information that you have
Thank you.
shared with us.
Thank you.
The question now I remember before closing.
Yeah.
I always feel that the immunity status of even younger people nowadays has
Right.
gone down.
Right.
Whether that has changed the way the investigations show up on blood, or rather, let me put it this way: that let's say someone who would be investigated for chronic diseases or cholesterol, diabetes,
Yes.
maybe after 40 or 50.
Yes.
Has it come down to a lower age, or is there any change in that number?
So I'll say this, Dr. Keyur, that earlier young individuals were not being screened. Okay, they were not being investigated. We don't know now if a person at 45 comes with diabetes, right? He is symptomatic at that point of time, but he has a very strong family history. So it is possible he must have got those things, or those things must have started way earlier, but was never investigated, right? So of course, the with more investigations and more diagnostic services available, people are now getting diagnosed early, and with the open-mindedness of people, they are willing to do investigations at an early stage or an early stage in life, right? So that is one thing. But in addition to that, of course, we have moved from a very active lifestyle which our parents and grandparents were having, and rather than we are most of our lifestyle is sedentary, and we work on a table and chair, and of course our food habits with all the Swiggy, Zomato, all those things coming in, and everybody are fond of food. So those things are definitely contributing to making the adult population a little unhealthy. I could say for sure. Yeah.
Okay, so now which means that maybe someone who was 45 had high blood sugar at that point of time would have started 10 years earlier with the.
It is possible. So there is diabetes doesn't come overnight. Okay,
Right.
it is a gradual process. So a person is normal, then the person is pre-diabetic, and then the diabetes sets in. So till the diabetes sets in, we are not generally investigating. The patient starts having symptoms. Many a times the patient is advised sugar test, they also ignore, and then when the first diagnosis is made, it does happen that this patient already has a kidney impairment. Okay, sometimes it does happen. So now, because of an early trend of diagnosis, okay, these kind of things are now avoided. okay, or can be definitely avoided if the investigations are done.
Right. So, what I understand is that if your doctor is advising you some investigation, rather than simply saying no or not doing it out of
Yeah.
concern or whatever it may be, please discuss with your doctors.
Right.
You will get answers to why those investigations are needed.
Absolutely. So, if at all you have a doubt on what these investigations are, you can always frankly speak to your doctor, and doctors are usually willing to help. There is nothing to hide in this, right? A doctor feels that so and so things are necessary when you go to him, and there may be a couple of things he might want to add or investigate further, just looking at the background of the patient, looking at the patient. He's overweight. Doctor will ask you for a cholesterol test. Why not? And why shouldn't he? It is ultimately for your good, right? The more data which is available, the more screening we are doing, the more we are going to be able to pick up those illnesses. And that is what should be done. That is the right way to do, right thing to do.
Right. Thank you, Dr. Pratik Jariwala, for this wonderful podcast that you had today. If you have any query, please mention in the comment. I will mention the email ID and website of Dr. Jariwala Laboratory in the description. You can reach out to them regarding queries for investigations.
Anytime. Yeah.
And we conclude this podcast. Once
Thank
again,
you.
Thank you so much for this.
Thank you so much. It's been my pleasure. Thank you so much for giving me an opportunity to speak to people. I generally don't get this kind of opportunity. So I always like to speak to my patients and explain them my lab reports. But ultimately sitting in a laboratory, I cannot always get in touch on a one-to-one basis. So thank you for this opportunity, Dr.
Yes, thank you, sir. So and we hope that people share this video far and wide with everyone for better health education.
Absolutely.